Fatigue, joint pain, swelling of the salivary glands, rashes, lung issues, kidney issues, and neuropathy can all be signs and symptoms of Sjogren syndrome. This is an autoimmune disease that affects predominantly females, but may be seen in males too. As many of you requested, I will discuss the current data that we have to treat Sjogren syndrome. I will start with a series of videos that will discuss how to treat the most common manifestations of Sjogren, and today I will cover how to treat mouth dryness. In the future videos, we will continue to discuss about how to treat dry eyes, how to treat vaginal dryness, how to treat skin disease, how to treat lung disease, and how to treat arthritis, but also how to treat neurological symptoms.
Rheumatologist OnCall.com.
How to treat mouth dryness. Sjogren syndrome causes inflammation and infiltration of the salivary glands with immune cells. Because of ongoing inflammation, the salivary glands will produce less saliva, leading to dry mouth. Now, dry mouth feeling is very unpleasant for many patients, but the consequences of decreased salivary secretion are increase in dental cavities, losing teeth prematurely, and inflammation of your gums. The gums will become red and swollen, bad breath, salivary gland stones, and sometimes candida in the mouth. Here I will discuss 10 tips that can help you manage dry mouth, most of them naturally. First, drink a lot of water, but avoid taking small sips throughout the day, as that can worsen the symptoms in some patients, but rather drink 1 cup of water at one time. Drink sugar-free drinks, as sugar will increase dryness. The more sugar you will eat or drink in any forms, the more dryness you will experience. Do not drink highly acidic drinks, Coca-Cola drinks, energy drinks, and avoid drinking a lot of alcohol or a lot of caffeine, because that can cause dehydration and lead to more dryness. Avoid nicotine. So if you are a smoker, stop smoking. If you are chewing nicotine, stop doing that for the same reason, because it will increase the dryness in your mouth. Use a humidifier in the room, especially at nighttime. When you sleep, if you are an open mouth breather, that will accentuate the dryness in your mouth and the nose. If you put an ultrasonic humidifier in the room, that will help you. I will put a link in the description of a humidifier that I use in my house. There are many humidifiers, but you should consider to buy one that is ultrasonic, because that will break the water into small particles that can get deeper and deeper into your airways. It is very important to maintain very good mouth hygiene. Why? Let me explain you. Your saliva has a great role in protecting your mouth from the effect of the bacteria that live in your mouth. Saliva contains lysozyme, that is a naturally occurring enzyme found in bodily secretions such as tears and saliva. This enzyme will function as an antimicrobial agent, destroying the bacterial cell wall, and will lead to their death. If you have left saliva, then you will have an increased risk in developing oral disease, and you can lose more teeth prematurely, as we discussed. So every day, use dental flossing, interteeth brushing. You should try to brush after every meal, and you should also use topical fluoride to reduce the risk of developing cavities, or you should consider to buy a toothpaste with fluoride. And it's very important to schedule your dental clinics every 6 months, as you will need to prevent diseases like parodontosis and remove the buildup plaque on your teeth. Some medications can also cause dryness. Let me give you some examples. Antidepressants, gabapentin or pregabalin, and antihistamine like Benadryl. If you take some of these medications, you should discuss with your doctor to see if you may avoid them or minimize the dose that you take. Now, to stimulate saliva production, you can also try sugar-free hard candies, sugar-free chewing gums, xylitol-containing gum or candy. You can also apply topicals like Xylimelt, citrus-flavored sugarless tablets, or oral drops, which can contain malic acid. But this acid is normally found in fruits, such as apples or pears, that will stimulate saliva flow. You can try to eat dry fruit slices, like peaches or nectarines, which can stimulate the salivary flow. If you still do not have enough saliva, you can also start using artificial saliva. Biotin products can also be used, and you can find them in the form of a gel or gum or spray. Lozenges with xylitol can also be used. I will leave links to many of these products in the bottom of this video for you to be easier to find them. As everybody is different, they might be helpful to you or they might not be helpful to you. But you should try them. If all of these fail, you can discuss with your doctor about medications such as pilocarpine or suvimulin. These medications need to be prescribed to you by your rheumatologist. Those are medications that are indicated to stimulate the saliva flow as long as you still have residual gland function and your salivary glands can still produce saliva. If you want to know if one is better than the other one, we do not know because there are not any studies to compare one versus the other one. Now, pilocarpine must be administered 4 times a day, which can be difficult for many patients. It may also cause flushing of your skin, nausea, and diarrhea. Suvimulin is given to patients 2 to 3 times a day and is better tolerated by many patients because it has fewer side effects when compared to pilocarpine. In some patients, hydroxychloroquine or Plaquenil can be tried, but the results are variable and inconsistent in improving the dryness of the mouth. Because every patient is unique, you should consult with your rheumatologist about what medication is best for you. Now, what products did you try? Which one was helpful for you? Leave me a comment in the bottom of this video. If you want to learn more, don't forget to give me a like, subscribe to my channel, and press the notification button to inform you about my future videos. And don't forget that these videos are for educational purposes and will not substitute medical advice, diagnosis, or treatment. You should always talk to your physician about the diagnosis and the treatment regarding your specific medical needs. Thank you and have a wonderful day.
Rheumatologist OnCall.com